I was given the honor to be able to come up here today and introduce Sarah Wright. And since February, Sarah has been a program manager with Way to the Fox Valley. And I didn't know if there was any particular rhyme or reason to how you decided who was going to introduce who, but my background before I got into the legislature is I owned 2 women's gyms that were weight loss oriented, and so this is something that is near and dear to my heart, and so I'm very honored to be able to introduce Sarah today. But Way to the Fox Valley, it's a community health initiative to help people be more active and to eat better. The group has private and public sector partners. It functions in Calumet, Outagamie, and Winnebago counties. And the United Way is a backbone of this organization. Before that, Sarah was with the Winnebago County Health Department. She's worked with farm-to-school programs. And I would like to say that I had a Lions Club meeting in Greenville last night, Sarah. And one of the projects that we approved was a $1,000 donation to an Eagle Scout in Greenville who was helping to build a greenhouse at Hortonville High School so that they were able to grow some of their own fruits and vegetables for the farm-to-school program. So, excuse me. This is something that's catching on. I think is very important. Sarah's commitment to health and the community is phenomenal. She has a great background. All the letters that she has designations for, it makes quite a list. She's an RN MBA, so that's pretty interesting that somebody has that nursing background, also has the business background. That's awesome. So without any further ado, Sarah, would you please come forward?
Okay. Thank you very much, Representative Murphy, for that great introduction. I really appreciate that, and also your support for this work that we are working together to do. And also to all of you for taking time out of your Friday morning to come and meet together and talk together and work together, as that's really what this is all about, is how in community health we can keep this work moving forward. It's also an honor and a privilege to be on stage with some really amazing community health leaders in the Fox Valley, so we look forward to hearing from them as well. And really, I'm here to talk specifically about Way to the Fox Valley, which you just heard a little bit of an introduction to, but it is an initiative in Calumet, Outagamie, and Winnebago counties, and really it's a collaborative effort with a shared vision of a community that together achieves and maintains a healthy weight at every age. So I want to just briefly, the challenges that we have with weight individually and as a community are not really a secret to anyone, but I did want to put one slide up here to really show how not only is the number of individuals with challenges in weight growing, so we have more individuals, but also if you look, this is overweight and obesity, and the blue section is the obese, and that's also rising. So that means that even as individuals who are having challenges, we continue to do it worse and have it become more of a challenge for us. And that really drives us to come to work every day and say, how do we create an environment of health that supports people wanting to make that type of change? So with that, a brief history. Back in 2013, through various community health needs assessments, community health improvement plans, recognizing partners in healthcare and public health and community health and the United Ways came together and said, obesity continues to be a challenge. How do we come together and tackle this together. And 150 individuals came together for several days and really dove in and took a look, and from that, Way to the Fox Valley was born, and the decision was made to adopt the collective impact model for social change. It's a big problem. We got to find some great tools to help tackle it. And so here you see the 5 elements of collective impact and how Way to the Fox Valley has really adopted that. The shared vision is that healthy weight at every age. From shared measurement, we looked at BMI as an overall indicator of the health of the community to just help us see, kind of gauge where we're at and where we're going. And the decision was made for 3 of our major healthcare partners in this area, Aurora, Ascension, and ThetaCare, to share their de-identified data around weight and height and BMI and kind of where people live to some extent, to say, what does the problem really look like and how serious it is, and help identify opportunities to do that. So agreements were made, that data is now being shared, and soon we'll be able to have a little bit more insight into the actual scope of this challenge that we face. And then the last thing I'll just point out is the backbone, again, the United Ways of Oshkosh and Fox Cities came together and said, we need to provide that continuing support for this to work. Also, as we look at this work, and we heard some of the introduction from Dr. Rudd, we want to make sure that, how do we decide what to focus on? There's so much great work happening. I've had the privilege of working with many of you in this room and many other partners. There's a lot of great things happening. How do we focus our efforts on what's going to be the most impactful? And so these guiding principles really help us to check our work, to check what we're doing, make sure we're focusing on things that have some evidence, that we have a health equity focus, so we're reaching all community members. We really have a broad reach. You know, there's 400,000 people who live in the Tri-County area. And so how can we reach as many people as possible through the work that we're doing? Focusing on those policy systems, environmental changes that we talk about so much in public health. So Way to the Fox Valley is governed in a variety of ways. We have a great leadership team of about 25 individuals from different areas across the region and all 3 counties, from different sectors, including business, nonprofit, healthcare, public health, and just a great group of people that help guide this work and meet on a quarterly basis to provide their insight and also connect us with resources in the area. We have a core team of great individuals, 6 to 8 members of that leadership team, who get together every other week to really help keep the work moving forward. And then we have action teams where we can connect partners all across the Fox Valley who are working to try to really get us to all kind of steer the boat in the same direction, to achieve more together and to set goals and to work on these projects that we've approved. And then staff, myself, we're slowly trying to grow the staff of the backbone a little bit, because as this work grows, we continue to need to make sure that we're able to address it. So again, back in the beginning, when Way to the Fox Valley was forming, the decision was, we're not going to start from scratch and reinvent the wheel. We know there's great work happening and great research that's been done, and so looked to the Wisconsin Nutrition, Physical Activity, and Obesity State Plan to say, what can we learn from that as a starting point? And what you see here is 6 of really the 7 settings that were highlighted in that plan, the 7th one being home, but looking at these other 6, how we can do work, and that will extend into the home ideally. And so that's really what then became, for Way to the Fox Valley, action teams. So those focus areas of the state plan become action teams. And I'm going to talk a little bit about 4 of those focus areas. The first one is active communities. So we know physical activity is an aspect of health, and it's an aspect of our weight, and also contributes to those things that weight affects, like diabetes and heart disease and orthopedic challenges and all those things. And coming at this as a nurse, really kind of get to the heartstrings and say, we want people to live healthier, and we can do that through things like physical activity, but creating an environment that makes it easier to be active. So a couple of projects that this group is working on, one is called Complete Streets, and we work in partnership with Melissa in East Central, so she's gonna talk a little bit more about their work, but really looking at our streets and saying, are they safe for all types of users? So people walking, do we have safe crossings? Are they well marked? Is it easy for people to go? Is there sidewalks or trails? Bicycles, is there bike lanes? Is there markings? Is there, are motorists aware of bicycles and sharing the road with them? And even wheelchair access and transit riders, so that everybody can get from point A to point B safely, and also hopefully then be a little bit more active in the on the way. So wayfinding is really, how do we take the existing infrastructure of all those great things that we talked about and really improve the signage, and how do people know where to go and how to get connected and raise awareness and be safe about it. So the next action team is the early care and education. That group started meeting recently with a target on age birth to 5, and are looking right now at a couple of different aspects of health there. One is greater access to fresh fruits and vegetables where children are. So how do we inspire kids to develop those healthy habits from an early age to make it easier to continue and support that on the long run? And then also breastfeeding friendly environments, whether that's the worksite or the child care center or the community. We know that breastfeeding is a protective factor for weight and health, both for the child, and it also helps the mom. So those are the things we're looking at in that area. The next one is the worksite. We really want everybody to have opportunities to have healthy behaviors when they're at work. So access to healthy foods and not being constantly maybe tempted in another way. How do we really create that supportive environment at work? People have an opportunity to be active. And so that's a challenge. You know, there are organizations that do it great, but there's also organizations that it's really hard. They don't have the resources, or maybe people work shift work. And how do we identify those barriers and help people and help, therefore, more employees to have that access? The last one I have up here is food systems, and we don't actually have an active food systems action team right now, but there's a lot of things going on in this area that we do have some partnerships talking about. Potentially, you know, how do we have kids' meals be healthier in restaurants? We have an Eat Well for Less social media campaign I'll talk about, and some other things that we'll get into. And then we also try to stay involved in those statewide partnerships like Health Tide, the Wisconsin Healthy Food Systems Alliance. You know, who else is doing this work that we can connect with? So this next slide is very full of words. So I won't go through it all, but just to show you that we're using the IHI driver diagram to really, how do we evaluate what we're doing? So we know in public health, we want to get out there and do stuff, and we want to change the world, right? But it's really important for us to learn, and that's part of why we're here today. You know, how do we learn from the work that we're doing, and how do we learn if we're doing it well and it's having an impact? And so the goal on the left here, or the overall goal in this case, is, you know, reducing the rates of childhood obesity, and then we look at different settings, and this one happens to focus on early care, and there's 3 primary or secondary drivers identified, including, you know, physical activity, breastfeeding, and nutrition amongst children in the early care setting. And then we're getting now to the level of the indicators. What are the indicators that we can identify, establish baseline, and establish goals and measure how we're doing? So for example here, you know, how many child care centers are actually designated as breastfeeding friendly? And there's a lot of great work already happening in our health departments there in public health, and how do we lift that up and extend it and do more? And also in the bottom one, you know, what's the percentage of redeemed WIC fruit and vegetable benefits? WIC is a great program, and we're getting fruits and vegetables out there. How can we help them achieve their goals? So these indicators are what we'll be looking at as we move forward and set those goals in those areas. So along those lines, we are working on a scorecard. So we're committing to having that come in January 2018 so that we can share with our community what we're doing and how well we're doing, and then learn from that and tweak things, or, you know, steer a little bit to the left if we need to. And so I just have a few sample indicators listed here. I talked about the complete streets, so number of complete streets policies that are passed. So that would be if a municipality decided that when they have new streets or street reconstructs, they're going to look at how do we make it safe for all users. How many people are then walking and biking in those targeted areas? So we can look at that before changes are made and after, and see what the impact is. In the early care setting, I already talked a little bit about those indicators. For work sites, how many organizations are having worksite wellness, and how many people are participating, and how many people are seeing an impact there? And then in food systems, it could be how many restaurants are offering fresh fruits and vegetables as the default side on kids' meals, because we know that that impacts the choices that kids make when they're eating away from home. And then on the right, I have a school and a healthcare icon. So those are the other 2 action teams or focus areas that while we do work in there, we haven't identified clearly the strategies moving forward, and so we'll be looking at that throughout the next year, and also saying where might some indicators be there. We certainly do work in schools and have a lot of great school partners, and so how do we bring it together again and try to make more of that work? I wanted to share this slide just to show you, there's 107 partners listed here. They all just came from our list of people who have some representation through our action teams. So it's just a great list. We have even more partners than this, but it's really neat to see the power of what we can do and how do we leverage that and really provide opportunities to take their work that they're already doing and maximize the value of that and bring it together to see those results and share it with our communities. So as far as, community connections, so in addition to working on all these big projects that we've been talking about, we want to be out in the community and connect with people and inspire people to change. And a couple examples of some early initiatives within Way to the Fox Valley. One is the Passport to Active Living, and over 2,000 people participated in that to really encourage them to use the existing trail systems and parks and be out there being active with what we have in our community. And then the pledge, we have this little pledge card that we take around with us just to encourage people to really pledge to change one behavior for their health. Maybe they decide they want to drink more water or eat more fruits and vegetables or walk more or whatever it is. Go to the gym as they plan to, kind of thing. So just a way to, again, raise awareness and encourage people at the individual level in our community. Some other measurements that we do have Facebook and newsletters. We got to get those numbers up, so like us on Facebook, look for Way to the Fox Valley. Contact me about our newsletter or go to our website, waytothefoxvalley.org, and sign up for that. But we are really trying to communicate with our community and share that information of what's happening, what work is happening with all of our partners, and how do we connect with that. So also, how many people are we reaching in the community and whatnot. This is our social media campaign, Eat Well for Less. We know people look to the internet and to Facebook and things like that for that. We have partners in Appleton doing family dinner night, so they're doing education around cooking and whatnot, and we're working with them to help evaluate it. How do we measure the success and tweak it to be successful in the future? Another way we connect with the community is quarterly breakfast. Here's some sample different speakers. You can see Dr. Remington from UW was there, Dr. Christina Economos from Child Obesity 180, and some local partners of ours. So Melissa's there. Great to have different topics to help people connect in the community and learn from each other. We did a research study talking to people who have had weight challenges. What drives you? What are some of your challenges? Just one thing I'll highlight, it's not surprising, this obesogenic culture that we have. So we are known in some places as being the brat capital or the cheese curd capital of the world or the beer capital of the world, those kind of things. So we live in an environment that makes it challenging at times. So my last slide, I just wanted to share a little bit about, in summary, kind of how do we share expertise with the community and how do we learn from our community. So one important thing that I mentioned earlier, and I'll say it again, is learning from that data. We get data from partners, we collect data on our own. We need to keep a focus on that, learning from each other. We have coalitions in the Fox Valley that are part of what we're trying to work with, and I try to get out and meet with them too. Rethink, Cahill, UCAN, at a statewide level, Health Tide, and some of those others. Connecting with the community, and then finally finding balance, because this is something every day that challenges me. We want to be out in the community, connecting with people, building relationships. We got these big projects we're trying to keep going, and really trying to find that balance is really, really important. And if we get down one road too far, it ends up being too much. So I appreciate, again, the time today to talk with you, and hopefully if you learned a little something about Way to the Fox Valley, I'd love to connect with you. My email is up there, sarah.wright@unitedwayfoxcities.org. Thank you.